Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to other organs, most often the liver and kidneys. It typically occurs after 20 weeks of pregnancy in women whose blood pressure had been normal. Preeclampsia can lead to serious, even fatal complications for both the mother and baby if left untreated. The exact cause of preeclampsia remains unknown and affects 3% to 7% of pregnancies. It is believed to originate in the placenta. Factors that might contribute to the development of preeclampsia include autoimmune disorders, problems with blood vessels, dietary factors, genetic factors. Risk factors for preeclampsia include first-time pregnancy, previous preeclampsia, carrying multiple fetuses, twins or more, family history of preeclampsia, obesity, maternal age over 35, being African American, pre-existing conditions such as diabetes, high blood pressure, or kidney disease, thyroid disease history. Exams and tests for preeclampsia. A healthcare provider will conduct a physical exam, which may reveal high blood pressure, often 140/90 mmHg or higher, swelling in the hands and face, weight gain. Blood and urine tests will also be performed, which may show protein in the urine, proteinuria, higher than normal liver enzymes, low platelet count, elevated creatinine levels in the blood, elevated uric acid levels. Additional tests will be done to assess how well your blood clots, monitor the baby's health. The results from a pregnancy ultrasound, non-stress test, and other evaluations will help your provider determine if your baby needs to be delivered immediately. Women who had low blood pressure at the start of their pregnancy, followed by a significant rise in blood pressure, need to be closely monitored for other signs of preeclampsia.
Treatment of preeclampsia. Preeclampsia typically resolves within 6 weeks after the baby and placenta are delivered. However, it may persist longer or even begin postpartum. Delivery. Often at 37 weeks, the baby is developed enough to be delivered safely. To prevent the condition from worsening, your provider may recommend inducing labor or performing a C-section. Management at home. If the baby is not fully developed and preeclampsia is mild, it can often be managed at home. Your provider may recommend frequent doctor visits to monitor you and the baby. Medications to lower blood pressure, if necessary. Careful follow-up due to the potential for rapid changes in the severity of preeclampsia. Complete bed rest is no longer recommended. Hospitalization. Sometimes hospitalization is required for closer monitoring of both the mother and baby. Hospital treatment may include close monitoring of the mother and baby, medications to control blood pressure and prevent seizures and other complications, steroid injections for pregnancies under 34 weeks, gestation to accelerate the baby's lung development. Timing of delivery. The timing of delivery will be a continuous discussion between you and your provider, considering how close you are to your due date, the severity of preeclampsia determined by blood pressure levels and abnormal blood test results, the baby's well-being in the womb, indications for immediate delivery. The baby must be delivered if there are signs of severe preeclampsia, such as tests showing the baby is not growing well or receiving enough blood and oxygen, diastolic blood pressure consistently over 110 mmHg or greater than 100 mmHg over 24 hours, abnormal liver function test results, severe headaches, abdominal pain, seizures or changes in mental function, eclampsia, fluid buildup in the mother's lungs, HELP syndrome, rare, low platelet count or bleeding, low urine output, significant protein in the urine, and other signs of kidney dysfunction. Pre-eclampsia requires careful monitoring and timely intervention to ensure the health and safety of both the mother and the baby. Prognosis. Signs and symptoms of pre-eclampsia typically resolve within 6 weeks after delivery. However, high blood pressure can worsen in the first few days postpartum. It's crucial to be aware that the risk of preeclampsia persists for up to 6 weeks after delivery, and postpartum preeclampsia carries a higher risk of severe complications, including death. If any symptoms of preeclampsia reoccur, immediate medical attention is necessary. Recurrence risk. Women who have had preeclampsia are more likely to experience it again in subsequent pregnancies. However, in most cases, it is less severe than the first occurrence. Long-term risks. Having high blood pressure in more than one pregnancy increases the likelihood of developing hypertension later in life. Regular monitoring and adopting a healthy lifestyle are essential for managing this risk effectively. Possible complications. Rare but severe immediate complications for the mother can include bleeding problems, seizures, eclampsia, fetal growth retardation, premature separation of the placenta from the uterus, placental abruption, rupture of the liver, stroke, death rarely. Having a history of preeclampsia also increases the risk of future health problems such as heart disease, diabetes, kidney disease, chronic high blood pressure. Women with a history of preeclampsia should be vigilant about their health and receive regular medical checkups to monitor for any long-term complications. Prevention of preeclampsia. There is no definitive way to prevent preeclampsia, but there are steps that can potentially reduce the risk. Baby aspirin. If you are at high risk of developing preeclampsia, your doctor may recommend taking baby aspirin, 81 milligrams, daily, starting late in the first trimester or early in the second trimester. Do not start baby aspirin unless advised by your doctor. Calcium supplement. If your calcium intake is low, your doctor might suggest taking a daily calcium supplement. No other specific preventive measures have been proven effective. It is crucial for all pregnant women to begin prenatal care early and maintain it throughout the pregnancy and postpartum period. Regular prenatal visits can help monitor both maternal and fetal health, allowing for early detection and management of potential complications. Alternative names for preeclampsia, toxemia, pregnancy-induced hypertension, PIH, gestational hypertension, high blood pressure, pre-eclampsia. What health conditions would you like me to cover in future videos? Let me know in the comments below. If you found this video useful, give it a thumbs up and subscribe if your body is important to you.